So I think if we could just go into a bit of an intro into stool withholding, like what is it, and I guess why does it happen to children? That'd
Yeah,
be really helpful.
definitely. So, stool withholding. So, it's basically when a child is making initially a conscious decision not to have a poo. So, they do everything they can to avoid doing this poo and to keep it in them.
Yeah.
So, there's different reasons why it can happen. And I think the most spoken about reason is that if they've had a problem doing a poo before, it's been a bit painful, it's been a bit upsetting for them. So, the idea is that they don't want to do this again. But we know from a lot of the research that's about, though, that there's also a lot of different sensory factors which play a role here as well. So it can be your child feeling a little bit upset going to the toilet environment. Perhaps it's the smell of the poo. Perhaps it's how it even feels as it's coming out of them as well. So there's lots of different factors that can play into stool withholding, and a reason why a child does it. It depends on the individual child, essentially. But the main thing they do is they're trying to avoid doing this poo, and they'll try really hard to do this. So you might find them hiding in a corner, crossing their legs. They might become quite stiff as they're doing it. And it's really common as well for them to become quite vacant. So sometimes it's as though they're in the room, but they're not really paying attention or concentrating on anything that you're really saying to them, because they're focusing so much.
Is that because they're focusing on like holding it
Exactly.
basically, and it takes a lot.
It's a pure concentration. Yeah,
it must take a lot of energy to hold that in, especially if
definitely.
it's been going on, a fair time as well.
Yes, definitely. And it's exhausting for the child, because as it goes on, so initially they're making this conscious decision to stop the poo coming out, but effectively they become so good at it that it becomes really an automatic process for them. The bowel stretches, so it becomes really good at keeping this poo in. It becomes really desensitized as well, so they're not essentially making use of those muscles at that time. They're not working as effectively as they should be, so then it makes it really hard for them just to go and use the toilet normally as we would expect them to be doing. So there's a lot of problems that basically come around the stool withholding.
Yeah.